Good morning. Happy Wednesday. Good morning. I just had to ask Nick and Melissa what day it was, and then I go ahead and I say good morning. Good afternoon. I did just wake up from a nap. Leah here from Wes and Leah 1023 XLC, and we continue this week's discussion. It is Suicide Prevention Awareness Month. So this week we are having that serious conversation because, yes, while it can be serious and uncomfortable, it is a topic that we need to be discussing. And I just want to start off by saying that help is available 24/7, that national hotline. I will keep that up there, 800-273-HELP, which is 8255. And then there's also that text number to home, 741-741. Want to introduce, though, Nick and Melissa. They are from the Lake County Prevention or Suicide Prevention Task Force. Excuse me. Thanks for joining me this afternoon, guys.
Thanks for having us.
Thanks for having us.
I still have the kids inside doing the whole e-learning at home thing. So I don't know what day it is, what time it is, where I'm at. Apparently this is also school, but that's the reality that we're dealing with right now. And we also have my cat joining me this afternoon. Okay, buddy, let's move you out of the way. Now, the Lake County Suicide Prevention Task Force, want to ask you guys how you got involved with this and how it all got started.
Sure. So the Suicide Task Force actually started a few years ago. It was originally formed in Waukegan, Illinois. And that was to support families who were affected by a series of police suicides. Since then, we've kind of grown into a larger nonprofit, realizing that we need to support more of the county.
Now, Melissa, what is your title there?
So my title is the Fundraising and Events Coordinator.
Because I said in the beginning of the week, a lot of people, whether or not they are struggling with their mental health or they know somebody that is, the sad reality is that people are going to probably either be affected by suicide or know somebody who is affected by suicide. But there are people that haven't been yet, maybe, or they just want to try to prevent somehow. They want to get involved. And for that, you guys are doing your suicide prevention walk, which is coming up. That is still going on, even though COVID. It's going to be virtual. And that is this next Saturday?
Correct. Next Saturday, the 19th, we'll be doing a Facebook Live event for everyone to join us. We'll be introducing some of our task force members, doing a few raffles, and just answering any questions and general information that we can provide for the community. This Saturday, we're having our t-shirt pickup event, though, so everybody can still wear their t-shirt on that day.
Awesome. Now, Melissa, why did you decide to get involved in this cause?
So I have experienced suicide with family members. And it's definitely something near and dear to my heart. Going further along in schooling and everything, I realized that suicide prevention is kind of where I want to be and need to be. So that's kind of pushed me into this direction.
All right. And then we welcome Nick, who is a chairman. Hi, Nick.
Hi, how are you?
I'm doing well. Now, you are a chairman, as I just said. And
Chairperson, yes, and chairperson of the task force, yes.
And Melissa, I'm sorry if you already said this, but how long has the Lake County Suicide Prevention Task Force been a thing?
Approximately 8 years.
8 years. Okay. And Nick, when did you join?
Probably about a year and a half ago. Okay. And I just became the chair around the end of May. So I was a member of the task force prior to that.
Okay. And how did you get involved?
Well, I got involved because I've been in the field of psychology for many years, and I have my own consulting and training practice, and I've been working with first responders and trying to prevent suicide and educating on suicide. I'm actually a board member for another group called Blue Help, which is an advocate for prevention of suicide in law enforcement officers, for which we have 120 suicides across the country to date. For law enforcement officers, we had 228 police officers take their own life last year. So when I got involved with the task force, it was partly to bring awareness to the first responder issues, and it kind of just morphed into other things, and really kind of a labor of love, so to speak, to really get involved and branch this out to the whole community. And looking at some of the initiatives as chair, looking at our LGBTQ population, our Latinx population, our African American population, really looking at specific groups, not just from a general sense, but looking at specific groups and groups that have been underserved. So we're gonna see a lot of things that are be coming up in the next few months to a year, trying to reach out to those groups.
Now, before we dive more into the numbers and, the signs that people are going to be looking for, the prevention, I just want to say thank you to both of you guys for what you're doing in the community, because it's definitely needed. And hopefully bringing awareness, can help with the prevention. And also, as much as I want that to end the stigma, which Nick, you and I talked about before we started a little bit, we will have time for questions later. There's a couple questions that are going to be popping up here soon. But first, Nick, I wanted to talk to you because you gave me some surprising numbers with Illinois and where we stand and our youth, which is, this is a huge issue right now.
It is, and before we even get into those numbers, one of the big concerns a lot of us in the mental health population are worried about is when right now we're in the throes of COVID and a lot of other issues, and one of the concerns is that we have people who may feel limited to try to get help, but we're also concerned as we have the fall approaching, the holidays, which are normally times where we do see depression rates and suicide rates creep up. We think that we're worried about things toward the end of the year possibly increasing in terms of depression, in terms of suicide. So we're trying to be as proactive as possible, not just with the task force, but in a lot of things I'm involved in, a lot of things my colleagues are involved in. We're looking at trying to be as proactive in prevention as possible. As you and I talked earlier, Illinois ranks 10th in the nation for suicides. California is number 1 in the country, but Illinois is ranked number 10. And when we look at male versus female, we have males who complete complete suicide. We don't like to use the word complete suicide, but to die by suicide 4 times higher than women. Women are attempters 3 times more than men. And we see that both nationally and within the state of Illinois. Typically, men will use one of 3 ways, where it is hanging, death by asphyxiation, or by using a firearm. In about 2/3 of cases, you see death by a firearm. Women, on the other hand, while they can use any means possible, you'll see oftentimes slashing of the wrists or taking pills, for which a rescue is more possible than someone who was to hang themselves or shoot themselves with a gun. So that's why we see those higher attempt rates and ability to rescue someone.
Now, I hate to go down like any kind of gender route here, but do you feel it's because of the gender roles we've given that men, it's, you can't feel this certain way, you got to be tough, and you can't and then they don't go get the help that they necessarily could have need, or they don't go and get the help soon enough?
There's a mixed. There's a lot of discussion on that. One of the things that men will typically do is something called self-medicating. They'll use alcohol. Alcohol is very readily available depressant, and some people try to use it as an antidepressant, but it has actually the opposite effect. And people use alcohol to self-medicate, and for whatever reason, men may not go and seek help. There's numbers that say women are twice. There's a 2-to-1 ratio for women to men to have depression. A lot of us in the field believe that's just underreporting, that men are affected by depression equally as women, and that is it a gender role thing? There's a possibility. It can also be that men try to look at that and say, I can fight this. I can get over this. I don't need help with it. I'm not going to, I'm going to fight this on my own. Women, on the other hand, they're smarter.
There you said
it. They go and they get the treatment. There was a great campaign from the American Psychological Association about 10 years ago, Real Men, Real Depression. I thought that was a beautiful campaign because they had firefighters, and especially after 9/11, they had firefighters and police officers and military and really the stereotypical male individual who presented and, I'm tough and, but I have depression. But it kind of had that, what you were getting at, to break down that gender stereotype. Because really, when we think about depression, it really doesn't matter who you are, what race, what creed, what color it is. Depression can affect you. And depression is not a normal thing. Even for somebody who has a chronic illness or a terminal illness, depression is not normal. We want to treat depression. If you're out there, if you're suffering with depression, don't wait for it to get better on your own. Seek out the treatment.
Yeah, I agree. And, from my personal experience, anytime that I would have a depressive episode, I would try to work through it. I would, we were talking, I can't remember what we've talked about off and on this recording, but where I'd go to work and I'd seem fine. And behind the scenes, it looked like I was okay. But then I'd just go home and I'd take a nap and I'd get up, go through the motions, do what I needed to do, and then get back in bed. And then until I could just get to the next day, because it did get that bad. And it took a lot to get out of that space. And there was no reason, at least like when people are like, oh, they went through a loss or whatever it may be. I had no reason. I can't put my finger on it. Everything in my life was seemingly, in a picture at least, going fine. But it wasn't.
But, and that's the thing. We always try to look for a reason. Why is Leah depressed? She has all this going for her, but that almost puts blame on you and really
Right.
That contributes to the stigma. It's like, well, Leah, you have everything going for you. You shouldn't be depressed. And that really is unfair to you, because there are chemical imbalances as part of it. There are things that you might have family that has depression or anxiety. It just may be carrying over from heredity. So, you brought up a good point of where you said, hey, I go to work, I went through the motions. There are a lot of people out there that go through the motions. You may have been real happy at work and nobody suspected you're suffering in silence. You're suffering at home. So one of the things to keep in mind to our listeners out there is to go ahead and check in on your friends and family, the ones who seemingly look like everything's going well. Check in on the ones that are, smiling and happy-go-lucky, because like you mentioned, Leah, some people can go do their 8-hour job and then they go home and crash, and then they just go back and do it the next day. But what you're not seeing is that they're suffering, and these are some of the people that we're concerned about that may harm themselves and may be really having a difficult situation. So,
well, and then one of the thoughts that I always had, not to get too much into what I've struggled with, but because not one mental illness is the same as the next, not one treatment is going to be, it's going to be different for everybody. But one thing that would always pop into my head regularly would be, oh my gosh, is this what somebody feels like that does attempt? Is that what like my end story is going to be? Is that, that was the fear that I had. And then my diagnosis was that I had obsessive compulsive disorder, and I had obsessive thoughts that I just continually honed in on and couldn't let go. So again, it is different for everybody.
right.
But my experience.
One of the things to keep in mind with persons who are suffering from obsessive compulsive disorder, a secondary condition is depression. So a lot of individuals who are suffering from OCD do have a secondary depression. So it's one of the things that we want to be very concerned about as well. And there is a concern for suicide with people with OCD.
Yeah.
because of that. So.
However, again, this can be a trigger for a lot of people. So I do still have that number up and running for anybody that is seeking help. Those are the national lines, at least, and that help is available for you 24/7. I know a lot of people right now that are feeling these emotions for the first time, whether it's because they've lost their job or they just feel isolated with the pandemic that's going on. Those are the people that I feel for right now, because for me, I'm used to worst case scenario. I'm used to this anxiety. I've been prepping for this my entire life. But there are people out there that don't know what to do with these emotions. So for somebody feeling that way, or maybe somebody's not and they know somebody who is, what are the warning signs, or I want to say warning signs, because as we just discussed, maybe there's not any signs, but what are those signs that you tell people to kind of keep an eye out for?
Well, some of the typical things that we see, and this is a little bit difficult, especially if some people, if people live alone, it's hard to find those warning signs now, because if you're staying at home and you're not going out much, you're not going to work, you're working from home. So some of those signs are not always seen. We can't necessarily see how the person's living or how they're wearing clothes. We can't really tell all the things, but some of the warning signs are when people, if we're looking for warning signs of suicide, well, historically, people who have attempted in the past, that is one of our biggest concerns. But we also look at individuals who have given stuff away, individuals who are talking and saying, Leah, if something happened to me, you would take care of my kids, wouldn't you? Or you look out for John, you look out for Sally. If they start talking about finality, or talking about, I don't know. Do you ever wonder what happens when we die? What it would be like if I wasn't here? You think the kids, my wife, my partner would be okay without me? They start talking in finalities. Those type of things are warning signs. If they have a means of access to harm themselves, those are concerns as well. We look at also the non-subtle signs. So say you have a friend or family member that you are seeing, or that you are aware they might be struggling. If they start kind of withdrawing from life, maybe you're taking pictures and they're not really in those pictures. They seem to be standoffish, just retreating from things. They don't really want to be too involved. They're not going out much. They're not wanting to talk on the phone or text you, and you don't see a lot of Facebook presence or Twitter presence. That's kind of a concern. You want to check up on them. So it kind of twisting this around a little bit, just for modifying it for the COVID right now, because not all of us are seeing each other these days. So those are some of the warning signs you might want to be on the lookout for. And I think one of the biggest myths that people have out there is, well, if someone's worried, if I'm worried about you, that you might harm yourself, I probably should not ask you. And that's a big myth. You're not going to, by asking someone if they're thinking about harming themselves, you're not going to push them over the edge. They're already thinking about it. The best thing you can do is to talk to them and ask them about it, because more than likely, even if they deny it, they know you're thinking about them. They know that someone cares. Best case scenario is that they're going to see the sunrise the next day, and maybe they'll come to you a couple days later and say, hey, I told you everything was fine. It's not fine. I think I need some help. So the biggest myth, and honestly, if I had $1 every time somebody said, oh, you're going to force them to harm themselves because you asked about it, it's not going to happen.
Well, that's like us having this discussion right now. That's why we're having the discussion, because that is a myth. Us talking about this, yes, it could make somebody who maybe hasn't dealt with it before, or been, a part of somebody's mental health crisis firsthand. It can make them feel uncomfortable, but that's part of the prevention of suicide, is bringing that awareness and ending that stigma. So how do we continue to reduce the stigma of suicide?
Well, I think it's also how we have to be comfortable talking about it, and we have to be comfortable in the language we use too. We have to be careful in the language, because a lot of people talk about committed suicide, completed suicide.
Successful suicide.
Yeah.
I do not like that.
Well, when we talk about people who have committed suicide, it has like this. Commit is like committing a crime. It's like a sin, or like you commit to a relationship. So you can have a negative and a positive connotation, but in this sense, it's very negative because what are you committing to? The person is going through a very difficult time. They did not say, yes, I'm going to complete suicide because this is my biggest goal in life. No, they're at a very low point of their life. And when we talk about completed, the complete suicide associates it with success. And when I've talked to people, family members of those who have died by suicide, this is far from being anything successful. The pain and confusion a lot of times as to why the person died by suicide is tremendous. So there's nothing successful about that. There's, success to me is when we can save a life, when we can prevent a suicide. That's successful. So those type of words, we don't want to say when somebody comes to us and says, I've been thinking about harming myself. I'm at a low point in my life. We don't want to say, well, things aren't that bad. You got everything going for you. I know how you feel. Things could be worse. Calm down. You're going to be okay. All those things are watering it down. They kind of placate. They're condescending. We want to say things like, take them seriously. Talk with them. Let them know that you're there for them. Never leave them alone. If somebody is thinking about suicide, whether or not they have a true active plan or they have some fleeting thoughts about that, we don't want to leave them alone. We want to, worst case, the biggest thing to do if you need to is call 911. Otherwise, bring them to the ER. But if they're thinking about suicide, we take that very seriously. We want to ask them if they have a means to do it, how long they've been thinking about it, what we can do to help them. Tell them that they're not alone. So those are the type of things we want to focus on, and really try to be that glimmer of hope for them. And because suicide, and I know people have said this before, suicide is a permanent solution to a temporary problem or temporary problems. And I know that sounds a little trite, but it truly is true, because these things could be situational. They may resolve. They're not always as bad as they may seem. We don't want to tell that person that, but we want to get them through. We right now they're seeing everything negative. They're not seeing anything positive in their life. And we want to make sure that they know that there's something to live for, and we want to help them through that. And so one of the things that Lake County also does, and I'm one of the mental health first aid instructors, Lake County Health Department has we've been kind of in hiatus a little bit because of COVID, but we have a grant that provides mental health first aid to the community, and really helping break down the stigma, talking about recovery, resiliency, and bringing this type of education to the community. It's like an 8-hour course.
Okay.
So that's also some of the things we've been doing and working on.
How does somebody get involved in that or get information about that?
That is on the Lake County Health Department website.
Okay.
For mental health first aid. Yep, they can look that up. And right now we're doing some virtual trainings. We're not able to do live yet because of COVID.
I think trying to understand where any of my mental health issues came from. I got as many books as I could find out there. When I did get my diagnosis of what exactly I was struggling with, and just reading up and trying to understand what I was going through, and that it does happen. I just want to go back on the one thing that you said about it being, having any kind of issues, how it's a permanent solution to a temporary problem. The comparison that I had today, actually, when I did my telehealth therapy, it's kind of like when you're sick and you have a cold or, the flu or whatever kind of illness you have, and you cannot remember ever feeling better, even though you may have only been sick for a couple of days. You don't remember what that feeling of normal feels like when you're sick. It's kind of the same when you are, going through a depressive state. So,
it's this kind of hopelessness, helplessness, especially for people with depression. They just feel like nothing's ever going to get better, and they can't see the light at the end of the tunnel. They can't see like, oh, I've always felt this way and everything is going badly, and they just can't see past that.
Right. It's hard to, sometimes describe that to somebody who may or may not have ever struggled with those feelings before. I want to get to a couple of questions here, Nick, because Ronald, he's been asking, he's been participating all week, really. And that was the wrong one. He would like to learn more. He's a veteran and he wants to help others out. Do you know of any programs out there?
There are some programs. Lake County veterans, I believe. TLS veterans, he might want to check with them. They're always looking for volunteers. Lake County Veterans is a very good partner. So is TLS veterans to help your brothers and sisters out there. So that would be something. I know for people who call the helpline that we've had, the 1-800-273-HELP. If you were to press 1, I believe when you press 1, it goes to the Veterans Hotline. So there's a Veterans Hotline available on that number as well.
Well, like I said, today we definitely did have a lot to get into, and I want to wrap it up real quick talking to Melissa again in case anyone's just joining us for the first time. Melissa, are people still able to participate in next week's event? Can they still sign up?
Absolutely. We still have T-shirts available.
Okay.
You can register online at Eventbrite. You also can register the day this Saturday at the T-shirt pickup. We'll be able to take cash, credit card, check for anybody who might just want to come on that day.
CLC.
At the College of Lake County in Grays Lake, correct? Thanks, Nick. So, even if you want to just stop by and get some information, we'll have extra resource packets as well. The resource bags will have all of the local Lake County organizations. So it's not even just going to be suicide prevention. There's going to be help for if you're drugs, alcohol, if you are just looking for a counselor. So everything's going to be in those bags as well. And we'd love to be able to see you and say hi. And if we can give you answer any questions and,
Awesome. Well, thank you so much for doing what you do as well, Melissa. Really appreciate it. And Nick, I could, no offense to you, Melissa, but I could probably sit here and talk to Nick for hours or just listen to Nick talk. You've had a plethora of information. I feel better myself. I've been having just the past couple days, the weather. I mean, I think that anybody, is feeling like, where the hell did summer go? Is it really gone? Did it just up and leave us that quick? And the gloomy and the lack of sunshine is something that I know affects me greatly. So just talking to you has been nice.
We're going to have we'll begin into the seasonal affective depression as well. For a lot of people will need some light therapy and increase their vitamin D consumption. So we'll be seeing that happening soon. But it's
my coworkers, I brought in have you heard of a happy light?
Mm-hmm. Yes. Yeah, the UV light, yes.
So I come in with all these different things that are that they say help solve my problems, but I was like throwing anything at the wall, whatever stuck, because hey, if it makes me feel better, why wouldn't I try it? And
30 minutes under the light, 30 minutes under that light, it's very helpful.
It just plugged right into my computer and it made a huge difference. I mean, I get up at 4 a.m. It's dark out, I mean, just waking up at that time could affect your mood too.
Well, and saying falling back doesn't necessarily help because you still lose sunlight. So.
Oh, yeah, that's still going to happen. Well, Nick, any closing words from you that you want to get out there for anyone listening right now that either is struggling or knows somebody that is struggling?
Mm-hmm. So 2 things. One, we're going to be launching the Reach Out and Listen campaign to coincide with World Mental Health Day next month. And we can talk more about that later. Leah, but really for anyone that is struggling, that want you to know that you're not alone, that there are people to help you. We have a lot of resources. If go to the websites, look us up on Facebook, the Lake County Suicide Prevention Task Force. But come on out to CLC this weekend. We'll be there from about 9 to 2. If you haven't signed up for the walk, stop by. If you need help, assistance, we'll have a lot of packets out there. But really, if you are struggling, please get the help that you need. Don't wait. Don't wait for it to get better or think it's going to get better. There are people out there that are willing to help you, and telehealth is probably going to be here to stay. So telehealth therapies can be done, and right from the comfort of your own home. So.
Excellent, Nick. Melissa, thank you both so much for being on with me this afternoon. I still wanted to say morning, but I hope that your guys' event is a success, and hopefully we'll be talking and working with you guys again real soon, okay?
Perfect.
Thank you so much, Leah.
Thanks, guys.